Every day, lots of people are getting hospitalized and are dying from food-related illnesses. This is because lots of bacteria make it into cans and milk and meat and anything that you eat, and it causes you to get sick. Well, things like canning our food and milk pasteurization has helped get rid of the bacteria. It has not gotten rid of all of it. They think that irradiation is the new way to help prevent all this bacteria coming into the food, and people are saying whether or not it is useful or not.
Irradiation is a terrible idea that has been come up with by professionals. Even the CDC and FDA seem to think it's a good idea. But in reality, irradiation takes a lot of the nutritional value out of food and can cause things like cancer. It is a terrible idea and should be gotten rid of immediately before worse things happen.
The central idea of the article that I chose is that irradiating food can help tons of people. It can help prevent illnesses and hospitalizations. He really wants to show that irradiating food is the best form of action to help the people. To show you that I understand his central argument, I pulled a quote. He says, "The potential benefit of irradiating meat and poultry alone is substantial. It could prevent hundreds of thousands of foodborne illnesses, thousands of hospitalizations, and hundreds of deaths each year." You know, he even went as far as to go to the Grocery Manufacturers Association and get a survey from them. While they are one of the largest trade companies in the world, they deal with food a lot. Now, they are so good that they have some of the top scientists, and Michelle Obama endorsed them. In their survey, they asked people what they thought about irradiating food, and 50% of the country was already on board with letting it occur. Now, the other 50% didn't really know what it was, or they were completely against it. Now, they also they projected more that if they informed the people on what it was, that 80% of them would be going for food irradiation. Now, he uses his information from them and lots of other reliable sources in his article to explain that food irradiation could kill 99.999% of germs in food. It could kill bacteria. It could cause hospital visits from foodborne illnesses to go down a ton. You know, he even has all of these primary sources from the CDC, from the FDA. He did his research. Himself, the author of this article, it says right here, he is a medical epidemiologist. And he's the chief of foodborne and diarrheal diseases branch at the Centers for Disease Control. He knows what he's talking about, and he just wants to help the people, and irradiation is the way to do it.
In the article I chose from Mercola.com, the central idea is that irradiation is bad and can cause terrible things to occur. There's text evidence in the article that supports this. He says, "This should be raising major red flags that irradiation is not as safe as food safety officials would have you believe." The primary source that he uses is about cats. The experiment is done by the American Association for Laboratory Animal Science. All involve expertise in the care and use of laboratory animals and are provided training essential for technicians, veterinarians, managers, and people just working with animals in a research setting. The data supports his argument. The cats were fed irradiated food, And while they were on the food, they developed severe neurological dysfunction, including movement disorders, vision loss, and paralysis. And they found that when they took them off the irradiated food, they became normal again. In conclusion, irradiation on food should not be used. There could be dire consequences.
After much discussion, we have concluded, based on the data presented from both parties, that irradiation is the way to help prevent people from dying and getting sick from food. While they do have a study showing that it caused cancer in some cases, that it has been proven more that is more helpful than harmful. The article I chose is titled Food Safety and Irradiation: Protecting the Public from Foodborne Infections. It was written by Robert V. Talks. He works for the Center for Disease Control and Prevention in Atlanta, Georgia, and he actually wrote this in June of 2001.
The article I chose is from Mercola.com. It is written by Dr. Mercola. He owns his own website and posts many, many things about diseases and such. This article was written all the way back in 2009, April 25th.